way that you can optimize your period, ladies, the better off you are, right?
If you had, and I know everybody's different, right? So this isn't a fair question, but I'm going to ask it anyway. If you could just throw out bits and chunks of like advice to young women, men, couples that want to get pregnant, what are just some things they can be thinking about besides coming in for acupuncture, right? But to your point, like don't keep your phone next to your testicles. What other things would you just throw out for people to start thinking about not doing or doing in order to help, fertility go easier?
I was like, good. Get your baseline blood work done, get your hormones checked, see where things are. Any way that you can optimize your period, ladies, the better off you are, right? So if you are having, you're bleeding and there's no clots and it starts pink and it goes in the red and then it just goes back on the pink and it goes away and there's no cramps and there's no PMS and your boobs aren't tender and you're not bloated and you're not crabby and you're not eating chocolate and pasta together as a meal the week before you're pregnant or the week before your period, you're fine. These are good markers. But if any of those things are awry, you need to work with somebody that specializes in internal medicine, like Dr. Cindy, or somebody that does functional medicine, so that they can start to unwind why does your period show up that way? Because it shouldn't, right? And birth control pills are not the answer for it, right? So, I'm not saying don't be on the pill. I'm just saying when you are ready to get off the pill, it's not like I'm off the pill, let's go get pregnant, right? Like do a little pre-work before that. So if any of that stuff is happening, get your baseline blood work with your functional people, and so that you feel good, right?